Hi, I'm Caro Smit, the founder and director of South Africans Against Drunk Driving. I am a psychiatric social worker and specialise in alcohol and drug education and counselling, and I've done that for donkey's years. I am a UCT graduate, and then for some unknown reason I seem to work in alcohol units and psychiatric casualty and alcohol hospitals. So I enjoyed that, and then I went and worked at Sanka Alcohol and Drug Centre and did a lot of the education in the schools on alcohol. And I always concentrated on drink driving because I saw there was a real need for it in South Africa, and the fact that very little information and very little accurate information was given about alcohol and drink driving. I was working with alcohol and alcohol education, and then unfortunately in 2005 my very precious son Chaz was killed by a drunk driver. So I just thought that I had all this incredible knowledge about alcohol, and if I just sat back and did nothing about it, I actually couldn't live with my own conscience, and I felt I wanted to contribute, and also I just felt a real need to really save my other family. And so I knew about this organization in America called Mothers Against Drunk Driving, and I contacted them and asked if we could start MAD in South Africa. And they couldn't see their way clear because they've got too many branches. So we started SAD. So SAD is South Africans Against Drunk Driving, but it's modelled very much on Mothers Against Drunk Driving, and in fact they help us a lot. So there needs to be people who give more education about alcohol and correct education. So the education, especially like what units of alcohol are, it's been given in a very sort of haphazard thing. They talk about one drink coming to, and you can't talk about drinks, you've got to talk about units. And you can't have just approximated unit, it's got to be very accurate. So SAD, we feel that that's what we've really done. We've tried to standardize units of alcohol in South Africa, educate people about exactly how much you can drink and what it comes to in breath and blood. And that's not just for the drinkers, it's for the law enforcers, it's for the magistrates, it's for the public prosecutors, so that you can win your drink driving cases. And so there was a need for this. There was also a real need for an alcohol expert, so that the media can contact us and ask us, and we can give them opinions from around the world. For example, bringing down breath and blood alcohol levels, and we know the research. We work with World Health Organization. We can say why it should happen. It's not a political thing or emotional thing. It's what is best practice around the world. So there's a need, and there's also a need to personalize the dead and to show that these aren't just statistics. They are people and what it's costing our country in terms of emotional and financial terms. So yeah, and the other thing too is to get South Africans to move away from being proud of drinking and driving, and to challenge those beliefs, and to really get people to look at alternatives. And since SAD have formed with a lot of pressure and a lot of the comments in the paper and the carte blanche and ETV, and we've had enormous coverage, we have helped a lot of people to set up companies like Goodfellas and Road Trip and all these people who are now making a good living, and that's saving lives. In the Western Cape, I mean, they've saved 1,000 lives just by really being proactive. And we've worked very closely with the Western Cape, and we've shared our information, like using name and shame in the newspaper and asking them to get special drink driving courts. And the Western Cape have been great because they listen and they say, wow, what a lovely idea, let's implement it. And yeah, so there is a need for a specialist organization on drink driving. We really felt there was a need for young people to learn about alcohol and drink driving because of the fact that the leading cause of death in young people is car crashes between 15 and 29. People need to learn about units of alcohol because a lot of people drive drunk by mistake. they have a huge party, and they wake up the next day and they say, I've got such a hangover. But they haven't got a hangover, they're still drunk from the night before. And so people have got to learn about elimination rates, and they've got to learn about breathalyzers. So we've been running programs for the last 5 years in 8 universities around South Africa, funded by South African breweries, where we teach up the peer counsellors and the psychologists in the counselling units to run the programs at the university. So those we've been doing very nicely. We have been running programs with taxi drivers, teaching taxi drivers about basic road safety and alcohol and breathalyzers. We have been working in schools where we've been training up the life orientation teachers and the social workers to run programs with the children. And once again, covering not just drink driving, but just alcohol abuse, trying to stop young people drinking, trying to get people to buckle up as well as drink driving. And then trying to get programs going in clinics. We are training up social workers, addiction counsellors, so that if somebody is drinking and driving, that they can then try and how they can help them to stop drinking and driving or to be more responsible. So it's a lot of quite practical manuals and programs that we have designed and developed. Basically, why we feel it is so important for graduated drivers to have specific number plates and to be graduated is that in the first year after a driver has a license, the chance of them having a crash and dying is very, very high. International research shows that. So by making them have a special P license plate and have 0 alcohol for that first year, we would have liked it to have been the first 3 years, but it looks as if it's going to be the first year. That has been proven to save lots and lots of lives. So we work together with Medical Research Council, who have been asking for that, and we've been supporting them as well as with Automobile Association. So 0 alcohol, also no driving late at night, having fewer passengers, not being allowed to speed. So yes, we were one of the people who were instrumental in pushing for it, and also for pushing to lower the blood alcohol content for general drivers, and 0 obviously for novice. And of course a novice driver is also somebody they could be 40 years old or they could be 18, but just generally it takes them time to learn to drive, so they need to drive slowly and carefully, and we're sure it will make a difference, as it has in Australia and England and America and everywhere. Yes. I won the Road Safety Achievement of the Year Award. So it was, I think all the journalists and the road safety people vote for somebody, and I was proposed and I won it. It's totally unacceptable. There is no excuse for drinking then driving, and there are lots of taxis, there are a lot of buses, there are a lot of alternatives. One has to stop being proud of it. It's got to be totally socially unacceptable. And so basically our message has been very much that drinking and driving is not an accident, it's a choice. And friends have to stop. So we've got to become like in Australia, where if somebody tries to drive, you stop them, you take away their keys. So that's the one thing. And the other thing that is so important, obviously for the government departments, they've just got to test. If someone's speeding, breathalyze. If someone's got bad tires, breathalyze. If you're checking a license, breathalyze. If you're checking a seatbelt, breathalyze. They have to do that all the time, because then the South African public won't take the chance.